How to lower blood pressure naturally in 30 days. High blood pressure is often called a silent killer because most of the time you do not feel it until something goes wrong. The good news is that simple science-backed habits can start bringing it down in as little as a month. Towards the end of the video, I will group the modalities according to their impact levels towards lowering high blood pressure. Welcome to Health Tips with Shalom Health. Thanks for joining us today. Please note that the content is for information only and not professional medical advice. Please consult your medical practitioner before you start or make any changes to your treatment regime. To start with, let's define what a high blood pressure is. It is a blood pressure reading of 140/90 or higher. Natural changes can help bring it down, but sometimes they are not enough. Some people still need medication, especially if their readings are very high or they already have organ damage, diabetes, heart disease, or a history of stroke. If high blood pressure is left untreated, it can raise your risk of heart attack, stroke, kidney disease, and even vascular dementia. In fact, for every 20-point rise in systolic pressure, which is the number above, or 10-point rise in diastolic pressure, which is the number below, the risk of dying from heart attack or stroke roughly doubles. And the encouraging part is this: even bringing your numbers down by 5 to 10 points can make a real difference. So now, what are the ways by which we can bring down blood pressure naturally? Let's start with alcohol. Even small amounts can push blood pressure up. One large study of 20,000 people found that the more alcohol people drank, the higher their blood pressure rose, even at just one drink a day. So cutting back, even a little, can make a noticeable difference. A good guide is no more than 1 drink a day for women and 2 for men. And just for reference, 1 drink means 12 fluid ounces of beer, or 5 ounces of wine, or 1.5 ounces of spirits. One of the most effective drug-free ways to lower blood pressure is isometric exercise. This has only been discovered in the last few years. It means holding a muscle still under tension, like with a hand grip or a wall seat. A large review of more than 200 trials found that this kind of exercise can lower systolic blood pressure by more than 8 points. A simple way to try is to squeeze a hand grip device, which is called a dynamometer, at an exertion level of 30% for 2 minutes. Then repeat twice on each hand every day. Or you can do 4 wall sits, each lasting 2 minutes, 3 times a week. Dark chocolate. Now here's one people usually like hearing about. Dark chocolate may help. It must be at least 70% chocolate content. A small amount is enough, around 1 to 2 small squares a day for 2 to 4 weeks. A University of Surrey study found some naturally occurring compounds in cocoa called flavonols can improve blood vessel function and help lower blood pressure, especially in people whose numbers are already a bit high. Fermented foods may also help. A British Medical Journal of Nutrition study of 20,000 people found that a healthier gut microbiome is linked to lower blood pressure. Foods like live yogurt, kefir, sauerkraut, or kimchi may be worth adding to your routine. Another big one is salt. It is one of the main drivers of high blood pressure, and cutting back can start helping within a few weeks. In the UK, adults should aim for less than 6 grams of salt a day, which is about 1 level teaspoon. The American Heart Association suggests aiming for 1,500 to 2,300 milligrams of sodium a day, but to aim for the lower end of the range ideally. 1 teaspoon of table salt contains roughly 2,300 milligrams of sodium. What catches many people out is that most of the salt we eat, 75%, is already hidden in packaged and prepared foods. It is a good idea to factor that in when thinking of adding extra salt to food. It helps to check food labels. And when you can, use pepper, herbs, garlic, spices, or lemon juice instead of salt for taste. Potassium and magnesium for blood pressure support. Potassium helps your body get rid of excess sodium. Food sources of potassium include bananas, leafy green vegetables, avocados, etc. Please take care with potassium intake if you have kidney disease. Magnesium helps your blood vessels to relax. Some food sources are almonds and legumes, amongst others. Together, both potassium and magnesium support healthier blood pressure. Hibiscus tea is another simple option. It contains antioxidants that may help reduce inflammation and block the same enzymes targeted by some blood pressure medicines. Some studies suggest it can lower systolic pressure by around 5 to 7 points. A common guide is about 2 cups a day. Ground flaxseed can also help. It is rich in fiber and plant-based omega-3 fats. A review of 33 studies found that 30 to 50 grams a day can meaningfully lower blood pressure, and that is about 2 to 3 tablespoons a day. An easy way to use it is to stir it into porridge, yogurt, smoothies, soups, or sauces. And it is best to use ground flaxseed rather than old seeds because old seeds can pass through the gut without being fully digested. Stress relief techniques to help lower blood pressure. Stress often leads to habits that push blood pressure up, like poor sleep, comfort eating, or drinking more than usual. Simple things like a warm foot soak, journaling, or a few minutes of medication can help calm your nervous system. And sometimes, one of the healthiest things you can do is slow down and say no. The DASH diet. When it comes to food overall, this diet is one of the best known approaches for lowering blood pressure. It stands for Dietary Approaches to Stop Hypertension. The basic idea is to eat more fruits, vegetables, whole grains, beans, low-fat dairy, lean protein, and healthy fats, and cut back on processed foods, sugary drinks, fried foods, and too much red meat. There is also the Mediterranean diet, which is a mostly plant-based way of eating that focuses on whole foods and healthy fats, with only moderate amounts of animal products. Just a little reminder, please don't forget to like, share, and subscribe to this channel to help it to grow. Thank you. Exercises to reduce high blood pressure. Movement is one of the quickest ways to help lower blood pressure. The British Heart Foundation recommends about 150 minutes of moderate intensity activity a week. For example, brisk walking, swimming, cycling, dancing, etc. That can sound like a lot, but it adds up fast. Even a 10-minute walk after meals can help. If weight is a factor for you, even a small loss can help. Dropping just 2 to 5 kilograms can make a difference. You do not need a dramatic transformation. Small changes really do add up. In general, blood pressure might go down by about 1 millimeters of mercury with each kilogram of weight loss. That is about 2.2 pounds. If you're not sure of how much weight to lose, aiming to lose 5% to 10% of your body weight can lead to measurable improvements. Also, the size of the waistline is important. Having too much weight around the waist can raise the risk of high blood pressure. Men are advised to keep their waist size under 40 inches, and women are advised to keep their waist size under 35 inches. Sleep is another important piece of the puzzle. Getting less than 7 hours a night is linked to higher blood pressure. It helps if you keep your room cool and dark. Stay off screens before bed, and stick to a regular sleep routine as much as you can. And if you smoke, quitting is one of the best things you can do for your blood pressure and your overall health. Smoking damages the walls of your arteries, making it easier for fatty deposits to build up. That narrows the arteries, reduces blood flow, and increases the risk of heart attack and stroke. Even breathing in other people's smoke can harm your heart and lungs. Caffeine temporarily raises blood pressure by stimulating the nervous system and tightening blood vessels. Reducing coffee, energy drinks, or strong tea can lead to small but meaningful drop within days to a week. What to do? It helps to check your blood pressure at home, as it gives you a clearer picture of what's working and what is not. What not to do? If you have been prescribed medication, you must never stop your medication without consulting your doctor first. Many people ask, how long does it take to see improvements in blood pressure after lifestyle changes? Some habits lower blood pressure quickly. Cutting back on caffeine or quitting smoking can help within days, whilst the DASH diet may start to work within a week. Reducing salt, drinking hibiscus tea, and eating fermented foods can make a measurable difference within 2 to 4 weeks. Exercise, weight loss, and better sleep typically produce more sustained improvements over 1 to 3 months, whilst limiting alcohol and managing stress supports long-term control. If your blood pressure remains high after 3 months, speak with your healthcare provider. Lasting results depend on staying consistent with these healthy habits over time. By how much can you lower your blood pressure? Not all blood pressure interventions have the same effect. The strongest evidence supports the DASH diet, regular isometric and aerobic exercises, and reducing salt intake. Together, these changes may lower blood pressure by 15 to 25 millimeters of mercury or more. However, never stop or change your prescribed medication unless advised by your doctor. Do speak to a doctor if your blood pressure stays at 140/90 or higher, if you have a headache, chest pain, or blurred vision. If the symptoms start suddenly or are severe, call the emergency services. Please note that this is not an exhaustive list. If anything feels off, please see your doctor. Lowering your blood pressure doesn't have to be overwhelming. Start with one simple step today. Take a brisk walk, cut back on salt, or make healthier food choices. Thank you for taking the time to watch this video today. If it helped you, please like and share it so that the algorithm can show it to more people. Awareness saves lives. Please don't forget to make comments about your experiences with lowering blood pressure naturally. Please subscribe to get notifications of further health education videos. If you would like to know about the risk factors and symptoms of high blood pressure, please watch the next video coming up. Thank you. God bless.